here, I'll either sit or stand or, but I'm going to just need someone to operate my slides there. I kind of picked this picture and it kind of shows the middle of a water main surrounded there. But I wanted to share and give you an international experience of kind of my journey overseas. I want to take you about 8,000 miles away to East Africa, and I just happened to be in East Africa with Dr. Susan and Dr. Corinne just a couple weeks ago, and they're be able to share some of these experiences also. I had the opportunity to connect with Dr. Jean Chamberlain from Save the Mothers. And when I met her, one of the things, especially with water throughout my blood and in my instinct, one of the first things I said to Dr. Jean is, what can I do? What can I come alongside of you to help you with in your journey that you're doing with maternal health issues? And one of the things that she said when I got to meet her, not only here but in Kampala, in Uganda, was she is doing some initiatives with mother-friendly hospitals. And she pointed me in the direction of one of the hospitals that I'm going to tell you about in the next few minutes. So the Koala Hospital, it's located about 45 kilometers outside of the capital, Kampala. And it's in the Mucky district, and it's located kind of in between Jinja and Kampala, and it's located on one of the busiest, most dangerous highways in the country. So we had one of our research students from that works with Dr. Jean and also at Uganda Christian University actually go into the community and kind of look at what was happening within this community of Kololo and in this district. And he came across exactly the same things that are happening with these wash issues, water and sanitation, and these issues of dealing with the lives of both women and children. The absence of water affects the home, that really the people that are bearing the brunt of the water issues are women and children. And the lack of education to some of these people in this community is directly affected by these issues of wash. So go to the next slide. When I started my first time when Dr. Jean took me to this hospital, it was an interesting journey for me to walk into a hospital that was very poor. It services about 600,000 people. But I wanted to introduce to you some of the people that I think were key into making this discussion within what we're calling the Mucky Middle actually a success, that you'll see in a few slides. And when I started the dialogue as an engineer, I came with my pad of paper and I had all these things written down. But fortunately for me, I had them written down in pencil, because most of what I had written down, actually in discussion with the leadership of this community and of this hospital, I had to start to erase and start to rewrite and begin to start processing of how I was going to intersect with this community. So a couple of these people which are important. This is the mayor of the town, and he was just so excited. You could see it on his face when we brought clean water, and he was a key person in connecting this community. Also, we have this lady who is the actual chief of police of the community, and she always kept me close by to make sure I was doing okay. And you'll see some other pictures. And this is Dr. Joshua, a very important gentleman. He's the first person I met when I entered the hospital, and he is the administrator and the superintendent of the hospital. And then this is our Dr. Eve. Unfortunately, she got cut off there, but she's our partner. She works with Save the Mothers. And this combination here, I'm going to talk a little bit about what I believe was able for us to enter into discussions at this Mucky Middle. And then also the staff. One of the things I want you to know is when I went there, and every time I was in Uganda, I would go back to the hospital and I would begin email conversations, phone conversations with this gentleman, Dr. Joshua. And all the staff, every time they saw me return, they said, this was their comment. They said, we were surprised you ever came back. We're surprised you came. And the day I landed, and I'm going to show you about the project, these nurses were actually in tears, even though I'd been there 3 times and been discussing with the hospital for 8 months, that they were in tears that this was going to be an actual reality. Because in the reality of the charitable world, and sometimes we see issues that are harder than we can comprehend, sometimes we promise things in this mucky middle conversation, which puts a harder emphasis on these recipients. So this is the hospital. It services 600,000 people. As I mentioned, it's located in Muttoo, between Kampala and Jinja. The hospital had no running water for the staff or the patients. So if you were walking into the hospital, you would either have to come with money to buy water, or have one of these people like Dr. Twin showed on a bicycle bring you water, or you would have to come with your own jerry can of water. We found hospital beds were torn and blood-soaked, infected, and they were over 30 years old. And they were dealing with about 400 patients a day, and with only one operating table. So after all this discussion, and I'm an engineer and I'm a water expert in terms of implementation and dealing with water around the world, this discussion expanded. They were like, Tim, it's just not about the water. It's also about what can we do inside the ward? What can we do about bringing different types of medicine, different types of gloves? I had no idea when I entered the hospital that the conditions of the mattresses that were infected for 30 plus years were in this condition. And we replaced all of them. But when I went into the maternity ward, the women who were giving birth would rather stay lying on the concrete floor than actually lie on these mattresses. The other thing that we were involved in that happened by discussion was changing the screens. You know, if we've been to Africa or in developing countries, insects and bugs, and they bite you and they come through screens. So we put brand new screens into the hospital. And then finally, we put in a clean water system that I helped design, but it was also something that was very easy, very simple, and very great to use. So what happened when we kind of came out of the other side of this? You know, after meeting the people, after going to a hospital that is suffering with so much issues, and having this discussion and trying to figure out how are we going to make an impact? How are we going to do something? We found through this journey that the morale of the staff, the patients, and the community totally transformed. It became an unbelievable thing to witness. We found that the new screens and the new beds reduced infection. We also found now that the mothers actually wanted to come to the ward. They wanted to sleep there. They actually had to tell some of the mothers it was time to go or time to check out. And then we also found that cesarean births had increased because cesarean births, when you're using dirty water or you're not practicing proper wash techniques, this becomes an issue. And overall wash practices improved. We found that the issues of having more water, the nurses and the staff were actually washing the floors. They were involved in more wash practices. And we found also that people from all over the community and all different communities wanted to come, involving the district, involving the ministry, involving the community to figure out, well, how could this happen? How could these people come together to actually make an impact? And then one of the amazing things in the last 6 months, and this only happened 6 months ago, is that the sepsis rates decreased from 8.6 to 2.8 in the first 3 months. And then right now they've decreased to absolutely 0 within the hospital, which is an incredible thing to happen. And in my last slide, this is the group of people that I believe conquered or brought the success to those statistics in the Mucky Middle. And again, you see this lady's very close to me, keeping me safe here, making sure I'm not going to get in trouble. I had to be on best behavior. But here's a gentleman named Zach, works with Save the Mothers and worked with us. So he's connected, again, with Dr. Eve, our link to the hospital. And then we also have all the staff totally transformed. They love to come to work. They're punctual. Everything began to change. We have this gentleman, Ben, he's the maintenance officer of the hospital. He has taken charge of doing things with the hospital. And then we have Dr. Joshua, we have the mayor, we have other different, this is a gentleman from the district. So we have all these different people that have come together, and with the understanding that individually they've done amazing things, but synergistically, I think when we come together in this conversation of the Mucky Middle, that's the only way that I can attribute why we've seen success in this hard, very difficult hospital where there was actually no clean water, there was no running water, and those conditions. And this is only the first step that we've taken. And so that's what I wanted to share with you. 8,000 miles away, that there is a way to find a way to have conversations. But my biggest thing was to arrive basically really with a blank sheet of paper or with a pencil. Because when you come with your own agenda and you're just there to push things, that's not what needs to happen. It really needs to happen that we involve everyone in the conversation and say, where is your part to play? What can you do? How are we going to do this together? And that's really the success. Thank you.